Melanoma and skin cancer in general are on the rise, especially, and this is interesting to me, among younger women. And with May being Skin Cancer Awareness Month, Dr. George Verghese is with us now to discuss the basics of skin cancer and what we can be doing to make sure that our skin is melanoma and skin cancer free. Doctor, thank you very much for coming in today.
Thank you for having me.
We talked during the break a little bit that I've learned my lesson the hard way. I had a melanoma right here a year ago, and I thought it was just an age spot or something. Let it go for a couple of years. Went in, did a biopsy, and boom, melanoma, and it put the fear of God in me. Lucky for me, it was in situ, which means
just at the top layer of the skin.
Just the top layer.
Not invasive at all.
Not invasive, yeah.
No lymph nodes involved, but if you're going to get melanoma, that's the one you want to get. It's easily treated. But you need to go, twice a year for a full body skin check.
Right, right. I have been told that. But I'm curious why this is on the rise among young women. That would seem to me to be the least likely group to get melanoma.
Very strange, but between 25 to 29 years old, #1 kind of cancer. And one reason is because of increased using of tanning beds.
Really?
The amount of ultraviolet radiation from these tanning beds can be as amount of 10 times the sun. So it accelerates the progression to skin cancer, especially melanoma.
So for so many young women, vanity trumps the health.
Well, and you got to realize there's these new sunless bronzers out. They can help you as well, so you can go that route. I was just telling you during the break, 18 years old. That was my youngest melanoma patient.
Unbelievable. And in that case, was it in situ? Was it a deeper? It
was a little deeper one, so we had to send her to Hopkins to get her lymph nodes involved and checked and things like that.
And this is going to be a very real risk for her throughout her life now?
Absolutely. I mean, she has to go, maybe even 3 times a year to get a full body skin check. Another thing I want to stress today is everyone should do a self-skin check. That's what I brought a handheld mirror as well, head to toe, once a month, behind your ears, toes, the whole deal. And obviously the back is difficult, so you may need to get a significant other to help you look at that. But there's a couple things to look for in this. One being asymmetric, B being an irregular border in these moles, C be different colors, whether it's brown, black, red.
Is that a different color within the same mole or same mark on your skin?
Exactly. Sometimes it can be on the periphery or outside, maybe even a lack of color inside. Another thing to look for is D stands for diameter, 6 millimeters or greater.
It's like 6 millimeters is how big? Just with your finger, how big is that?
Pencil tip eraser. Just remember, like a pencil tip eraser. And maybe the most important, E for evolving or changing. What's changing over time? Changing color. Maybe it's scabby. Maybe it's bleeding. Maybe it's just looking red, angry, scaly. Things like that. That's when it tips you off, hey, I need to go see a professional about this.
And these things don't necessarily have to be painful in any way, shape, or form, right?
Absolutely not. It's almost very similar to diabetes or hypertension. You sometimes don't know you have these disease until it's too late.
Right. And what happens with melanoma when it's more than just skin deep or top layer skin, more than just in situ? What happens to it, and why is it such a risk to us?
It's very dangerous because it can go to your lymph nodes, spread through your blood system, affect your brain, your heart, kidneys, liver. So in 6 months, it could be fatal, so it's very important to detect it early.
And we've seen so many people still, in spite of all the evidence, going to tanning beds or going out to the beach and, getting burned. It's just, it defies logic.
It's part of our society. And, everyone wants to look great. They want to look tan. They want to look slim. It's just part of the pressures that we put on ourselves. But that's why today's Melanoma Monday. May is Skin Cancer Awareness Month, to tell people, to educate people that, hey, these are things you need to look out for. You need to see your dermatologist. You need to be more aware and take responsibility of yourself.
Yeah, this is an important message to send home to parents as well, because I know from my experience with skin cancer, the doctor said oftentimes these kinds of cancer are a result of being badly burned when you're young, or several burnings when you're young. And in my case, at my age, my buddies and I were always out playing, getting bad sunburns, putting the Solricaine on in the aftermath of it, trying to remedy what was wrong to start with. But nobody paid attention to it when I was a kid.
That's right. A lot of my patients say the same thing. That's why, parents nowadays, the younger parents, they're usually putting sunscreen on, which AAD recommends 30 or higher nowadays. And it's almost like combing your hair, brushing your teeth in the morning. If you get into that habit, then it's like second nature.
Sunscreen, are there any brands that are better than the others, just as long as you have that SPF number that's high, 30 or higher? Is that good enough?
That is, the 30 or higher is good enough, but one thing to remember is the number only corresponds to ultraviolet B protection. Make sure the label says UVA and UVB protection, because that broad spectrum is very important. So
what is the difference between UVA and UVB?
There's three kinds of ultraviolet radiation from the sun. C, blocked by ozone. B causes a little bit more of the skin cancer, has a little bit more energy, and A is the one that can sometimes go through a car window and causes aging effects. So A and B are the ones that kind of act together to create most of the skin cancer.
Interesting. Because I always thought that car windows prevented the transmission of that dangerous kind of sunlight. You're telling me that's not true.
It blocks B, but not A. So a lot of truck drivers, taxi drivers, you'll see the whole left side all like sun damage, photo damage. You know, they may get more skin cancer on that side. It's very interesting.
Yeah. Okay, well, I certainly learned my lesson, and I hope your advice today helps so many others learn it as well. Dr. Verghese, thank you so much for coming in today.
No problem. Thank you so much.